My name is Michael Lichtenberg. I'm an interventional angiologist from Arnsberg Vascular Centre. Arnsberg is in the west part of Germany. So the BLUEFLOW venous stent is a dedicated venous stent for deep venous intervention, especially in patients with post-thrombotic syndrome or acute DVT. This stent is a woven Nitinol stent, so a dedicated braided Nitinol stent for the treatment of acute and chronic obstruction of the iliofemoral tract. Interestingly, this stent showed very good initial data from feasibility trials as an extension stent, especially below the ligament. We aim to analyze the safety and efficacy of this stent within a prospective registry, analyzing this stent as an extension stent for deep venous obstruction in the acute and chronic situation. And this is what I would like to show you now. So this real-world BLUEFLOW registry included 67 patients. Patients have an acute and chronic venous obstruction of the iliac tract. And what we found was a very great primary patency rate after 12 months for patients, especially with chronic venous outflow obstruction. So these are the worst of the worst patients having a previous DVT in the past. And we found a primary patency rate after 12 months of 72.6%, which is a little bit better than in other reported stent outcomes in the same indication, especially around the ligament and in the chronic venous femoral and in the venous system distal to the ligament, so in the femoral vein or around the ligament, especially in the external iliac vein. So when we combine our data with a different study we also recently published together with our colleagues from Zurich, where we analyzed this efficacy of a BLUEFLOW venous stent versus standard laser cut Nitinol stent as an extension stent in the external iliac vein and a femoral vein, add together with our BLUEFLOW all-comers registry, real-world registry, we can definitely say that the BLUEFLOW venous stent as a braided stent has much better outcomes than laser cut Nitinol stent as an extension stent. And the reason is quite simple. We know from laser cut Nitinol stent that these laser cut Nitinol stent have a high risk of stent fracture, for example. Doesn't mean that every stent fracture leads to a reocclusion or a re-interventions, but we know that there's a significant increase of re-interventions when stent fractures occur. The real advantage of a woven, of a braided stent is that no fractures occur. And this seems to be one of the main factors why the patency rate are much better of a BLUEFLOW dedicated stent than a laser cut Nitinol stent. So we definitely need more multi-center prospective trials. So I'm talking about the 2-center trial and the 1-center trial. So the next step especially is to validate these outcome data to start a prospective multi-center registry, which is planned, and hopefully we start in the second half of the year to get more data for a dedicated braided stent as an extension stent.